we don't take questions now.
So I call upon Dr. Amitabh Singh to come and tell us about the optimal timing of first cystoscopic follow-up and using time to treatment initiation analysis.
So good morning everyone. So topic given to me is what is the optimal timing for the first cystoscopic follow-up. So what we know about this thing, so various guideline recommends that first follow-up cystoscopy should be done at the 3 months. However, reason is unknown. It is just based on a presumption that it should be done at the 3 months. And it has been seen that TURBT at 3 months is a very important prognostic indicator for the future recurrences and progression also. So there is a one randomized controlled trial, although the number of patients was very less in this randomized trial. So it compared 6 monthly and 3 monthly follow-up cystoscopy, and it did not find any significant difference in terms of recurrence and progression. Although in our practice, almost more than 80% of the patient, they underwent cystoscopy either at 3 months of the follow-up or 4 months of the follow-up. So aim of this study was to define the perfect timing of cystoscopy, first cystoscopy after the TURBT. So this is the schema of the study. So it was a retrospective study. Data was collected from National Health Record from the Korea. So it almost included more than 25,000 patients. And it sub-stratified the patient depending on the timing of cystoscopy, whether cystoscopy was done within 2 months or 2 to 4 months or 4 to 6 months or 6 to 8 and 8 to 12 months. So this is the distribution of the cystoscopy, timing of cystoscopy. So most of these patients, they underwent cystoscopy between 2 to 6 months. And when they analyzed the hazard ratio, they found that recurrence was lowest when the first cystoscopy was done at 5 months, whereas the progression was the lowest when the cystoscopy was done at 4 months. Same with cancer-specific mortality and all-cause mortality. When they were done at the timing of 4 months after TURBT, then the incidence were the lowest, hazard ratio was the lowest. So they concluded that the timing of first cystoscopy follow-up was, it should be at the 4 month, and it has proved that with this study that it is a oncological more safer than having a cystoscopy at other times. And apart from this, there are a lot of flaws into this study because this is a retrospective study. A lot of various high-risk patients were not included in this patient. Those patients who had CIS, multifocal tumor, TA, T1, they were not included because they didn't know, because all of these patients, they were included because the surgeon put the code. This code, depending on the code the surgeon put in the record, they retrieved the data. So there are a lot of flaws in this study, but still we now have a very large number cohort retrospective study data, so that we can say that like that 4 months cystoscopy is ideal timing. So the most important is the second one, actually abstract.